Okay, so we're gonna look at, first things we're gonna assess the breathing portion, okay? So, like I said, most brain traumatic injuries or concussions have breathing issues. So if you look at Brad breathe, so big breath in, breathe out, and breathe in. So there's no movement here. We can also see there's movement on this side of the body. There's no movement on this side of the body. If I look at his chest as well too, there's no movement in this side as well. Again, breathe in and out. Now if I come down to his legs, and I'm just gonna load up on the leg here, we're gonna see where his body is actually moving. See how everything wants to go to the left side right now? But look at his right pec minor in the chest is not moving. So what I'm seeing when I load him, he doesn't want to move here. So watch again. See how he doesn't want to move? Look at his left hip. His left hip is not moving either too, because his right shoulder is not moving. So you always have that compensation, so the zigzag. So right shoulder, left hip, left knee, ankle are being affected. So he's got the cross compensation pattern going on. So then if I do the other side too, I'll load up. See how different that is? See how the whole body moves when I load this side? Again, when I do this side, see, half the body moves. Yeah, again. This is why I do the body testing and the breathing before I start, just to see where it's going. So that's why I talked about this ankle being jammed. So if I test the ankle now, okay, I'm gonna see where he's moving. He's stuck there. Talus is stuck there, it won't go any further. Now if I do the other side, can go all the way. See the mobility is there? So this is the first thing that's gonna start, because this is actually a pelvic floor. So we've got 8 pelvic floors in the body. One on the ankle, one at the knee, got midpoint, upper thoracic outlets, and then right around the hypoglossal and hyoid bone in the neck, okay? So we're gonna start off with the ankle, so I'm just gonna traction through and pull up, traction through, up. So I have my talus joint, basically calcaneus, talus. I'm trying to get the talus joint to slide back because the talus joint is slide forward. So I'm coming in, pulling there. Okay, and come around. Good. Nip on the first met, just because the first met is out. There, and now full flexion, full extension. Again, the reason why I'm adjusting the ankle, because the head and neck do this movement. If I don't touch this guy, he's right away gonna go back on his toes. Okay, then we're gonna move up into the upper body and to where he's having the breathing issues now. Okay, so again, big breath in for me, Brad. And out. Okay, so this is called the deep 6. Okay, I'm gonna grab internal, external obliques, rectus abdominis, and I'm gonna grab it all together, and I'm gonna compress it in. So I call it the deep 6. Because we're getting transverse, rectus abdominis, internal, external obliques on both sides, and I'm bringing it in. Right now, rectus abdominis is overstretched. Belly is out, so we're overstretched. So again, and if I want to add a bit more, I'm gonna use the table, like I said. So I'm gonna stretch him out a bit more to put more pressure on the vagus nerve on the back, and then coming in. There we go. And breathe in again for me. Breathe. And breathe out. So you can see he's struggling to breathe right now because I'm actually resetting. There you go. Keep going.
And what are you feeling? Do you feel it released?
I'm feeling tension right now, and him actually struggling to take a breath in right now. You can Can you hear him when he's bringing it through the nose? That little.
It's been pulsed.
Yeah.
Pulses,
Yeah. Good. Now breathe in again. And out. And I'm gonna just spring off of there, and then I'm gonna get him to breathe in. See how much better that is now?
Man, that's crazy good.
Yeah.
It feels effortless for me to take a
Yeah.
breath.
So breathe in again.
So on a flat table, what do you come to?
On the flat table, you can put a pillow underneath there to intensify it.
So if you get a full night's sleep, are you even in
I'm sorry.
You get full night's
You get
sleep,
full
you're moving in
night's
with me,
sleep.
right?
Oh, listen.
Yeah. Now,
I'll hug him after because
Yeah.
if he helps me sleep, he's helped me lots. Don't get me
Yeah.
wrong. He treats me enough.
yeah. So now we're looking. So when he breathes in, I want you guys to look here, where he's not breathing now. So breathe in. See, none of this is moving. None of this is moving on the side. So it's lower pelvic floor is affected. So I fixed the upper thoracic pelvic floor. So now watch this. I'm gonna pull the belly button across, and then I'm gonna push it down to load the lower pelvic floor to spring it back up. Okay? So what we're doing is we're increasing the abdominal pressure with air, and then springing the lower pelvic floor to raise it up. I use this a lot with women, especially with endometriosis, PCOS, pelvic floor dysfunctions, incontinence. It helps to reset the bladder as well too. So this technique works phenomenal, specifically for women's health as well too. Like I said, a lot of these techniques, you can apply them in different areas, and just thinking about where you can apply them. So I'm also showing you guys other areas, not just for concussions, okay? So watch again, breathe in, breathe out. So I'm gonna pull that ligament across, and then I'm gonna push it down, and he's gonna take 3 big breaths in. And out, breathe in, and out, breathe in, and out.
I'm sorry, which ligament are you?
The L4 ligament,
Oh.
the L4 ligament, it's a fascia that attaches where the belly button is, and it goes all the way down. So now watch him breathe in again. See, now this is moving. So the pelvic is actually tilting now. I'm gonna show one other way to do it too, because I was showing you just so everyone can see. Again, you can breathe in, Brad. Breathe out. I'm gonna pull the ligament across and then down, and then breathe in. And out, and breathe in, and out, and one more time, breath in, and out, and reset. So now you can see I got this pelvic moving well when he's actually breathing in.
That's if the pelvic floor is weak but tight.
It's tight, and tight and weak, yeah.
As in too much downward pressure.
Too much downward pressure, so it's locked, it's in spasm. That's why he had the anterior pelvic tilt, and we saw the tightness all in through his back. And again, if you want to raise the legs up higher into this area too, I can shorten it as well, doing it easier. So breathe in again for me, Ryan. Breathe out, and I can actually get a deeper release with bending the knees. Again, breathe in. And out. And one more time. And out. Good. Or I can modify it with doing my own body. So bend both knees for me, Brad. Bring them into flexion. Bring my legs up. So now I can have control movement of the legs back and forth if I want. Or I can stretch them out further. And same thing coming in. Breathe in and out, and then I can pull back with my body and breathe in again.
Is that comfortable for you?
It's very comfortable for me.
Okay. And you don't feel the weight of him?
No, I feel like I'm stretching my back, my hips. And I can tilt him this way. I can tilt him back this way, so I can like rock him at the same time, which is very soothing. Good, and then come out. Good, and now breathe in, and we should see some really good movement now. Big breath. and out.
Now I see it.
Yeah.
So it's weird. I feel like I'm getting air.
Yeah.
I mean, I know that sounds odd. I know I breathe, but
So now we're
it's
gonna
not-
go
It feels easier to
and
get
retest.
air.
So now look. The whole body is moving. Nice. Again, I'll go here. Okay. Now the only area we're kind of seeing is now right in the chest area with the head and neck. Okay. So most of it is stuck in through here. So this is why I say concussions aren't just the head. It's the thoracic, the clavicle, the whole rib cage in through that area. So what we want to do is work on this clavicle that wasn't moving because we saw this wasn't moving. So first and second rib are out. So we're moving first and second rib up. Again, I'm bringing his head there because I'm shortening the nerve bundles on this side. I see the movement I'm getting now in the shoulder. And I'm gonna go underneath, hook into subscap, T4, T5, and I'm gonna pull this over. So I'm shortening again. You see how he's having the breathing again? Again, you can do it this way as well too. Grabbing both and I just lean back. And breathe in again for me. And out. So what I'm noticing is when you breathe in through this nostril, it's not moving now. So I'm just gonna come in, get the sinus, upper sinus, lower sinus, because the septum is a little bit deviated. And then I'm gonna pull and bring that through. Okay? Pull, bring that through. And again, pull and bring that through. Okay, and breathe in again, Brad. That's better. He's just having a bit of issues here now. So I'm gonna grab the hyoid bone. I'm gonna shorten the hyoid bone up. This will help with that hypoglossal issue that he's having in his tongue. And I'm compressing the two in together. If someone can pass me the neck model, just the neck one. Perfect. Let's grab this guy off. Thank you. Okay, so the hyoid bone sits about here. What I'm doing is I'm drawing it in. Okay, I'm shortening this area because the cranial nerve is overstretched on him, so I want to shorten that side. So if that's on him here, I grab it here, and I'm pulling it inwards.
So bringing it up into the chin.
Up into the chin. This will help a lot with snoring, so if anybody has a husband at home or kids that snore, or you're nudging them at night, this is a good technique to bring it in. Good. And I'm just going to come under here on the parapterygoids and the platysma fascia.
So if they have apnea, that can help.
Yeah, sleep apnea, huge. Too many people are on sleep apnea machines and they don't need to be. It's just because things are tight or stressed out. Go ahead and breathe in for me, Brad. And out. So you can see now how much better it sounds, even the way he's moving now through the chest. Thank you. So if I actually move him now, you can see whole body is moving really well. And then I try to turn his head. Yeah, I didn't have that rotation before. Now if I try to go an extension, flexion, he's still stuck right there. So there's a bit more work. So I'll show you guys the muscle energy one. So push into my right hand. 1, 2, 3, 6, 7, 8, 9, 10, and relax. And then push in again, Brad. 6, 7, 8, and relax. And one more time. And relax. And I'm gonna pull out and then through. So now if I check the head, I can go this way. I can't go that way. So now I'll do the same thing on the left side. So let's push in left. And relax. Push in again. Relax. And one more time. And now I'm going to take him in through there and then traction back. So now we can go. And now I just got suboccipitals and posterior. So my hands are right in underneath here. Okay, my hands are right in underneath here, okay? So splenius capitis, splenius cervicis, medial erectus. And I want to do this forearm traction, one underneath, and then I'm just going to push it up. Leave it up. Leave it up. And this is just because he's not used to it. With him doing the bobsled, he's just got chronic scar tissue and tension from the amount of whiplashes. So this area is used to being locked solid to protect itself. Now, see how much more movement I got? And then I got full rotation now, and full rotation now. Okay? So that's how we're gonna do this. Okay, so I want everyone to hop on the table, and then we're gonna go over how to do the diaphragm release first, okay?